Welcome to the recorded version of the Grantmakers and Aging web seminar, Strange Partnerships, Bringing Together New Resources to Meet Critical Community Needs, featuring Ellie Hollander, President and CEO of the Meals on Wheels Association of America, Thom Reilly, Executive Director of the Caesars Foundation, and John Feather, CEO of Grantmakers and Aging, from September 27, 2013. This event was made possible by a partnership between Grantmakers and Aging and the John A. Hartford Foundation. Technical and production support is provided by the American Society on Aging.
Thanks, Steve, and thanks to everyone who's joined us today. This is part of our continuing series of monthly webinars on critical topics of interest to funders in aging. Today's session, as Steve told you, is entitled Unusual Bedfellows, Sharing a Common Interest to End Senior Hunger. I'm very happy that so many of you have been able to join us today. Before we begin, I want to thank the John A. Hartford Foundation of New York for their continuing support of this series. I also want to thank the expert team at the American Society on Aging for providing technical and production support for the series. Hunger among older Americans is a dire need. Over 8 million seniors struggle to meet their basic nutritional needs. Many of the established programs that have tried to meet this need are under tremendous strain as the need increases and the resources decrease. Today, our unusual bedfellows, Caesars Foundation and the Meals on Wheels Association of America, will share why they are a match made in heaven, dispel the top myths about senior hunger in America, and discuss what they are doing to address an issue about which we should all care very deeply. This is a chance for us all to learn about how innovative partnerships such as this are transforming long-established safety net programs at the local and national level. We are pleased to have two of our nation's experts to help guide us through this discussion. Ellie Hollander is the President and CEO of the Meals on Wheels Association of America, and Thom Reilly is the Executive Director of Caesars Foundation. Welcome to you both.
Welcome. Glad to be here.
Thom, let's start with you as we move to the next slide. Tell us something about Caesars Foundation.
Well, the Caesars Foundation is actually the philanthropic arm, a nonprofit arm of Caesars Entertainment, which is the largest gaming company in the world. Our primary focus is that on helping older individuals live independently, maintain optimal health and proper nutrition, avoid social isolation, enjoy mental and physical vitality through all stages of the aging process. It's been our long-term commitment since we were formed in 2002, and our total give since 2002 has been approximately $65 million. Worldwide, we primarily give in those communities where we operate. It's to give back to the community and to the employees, but we're glad to be a partner with Meals on Wheels and also a voice on older individual issues affecting older individuals, particularly on the issues of senior hunger.
Thanks. As we go to the next slide, Ellie, many of our listeners will be familiar with Meals on Wheels at the local level, but tell us a little bit about the Meals on Wheels Association and the work that you do.
Sure. It's a pleasure to be here, by the way, John. Thank you very much for the opportunity and for those webinar participants with us today. The association was formed in the mid-'70s as a 501c3 to really represent the global interests of senior nutrition programs across the country and the U.S. territories, to really provide a national presence, to build awareness and amplify the message around the issue of senior hunger in America. As with most membership organizations, we're located near Washington, D.C. We happen to be in Alexandria, Virginia. But we spend a lot of time on Capitol Hill advocating on behalf of our members to ensure that whatever funding can be available is there for us. We also work with national organizations like Caesars Foundation and others to develop partnerships that can then be translated to programs at the local level. Most foundations are interested in having local impact. So we sort of serve as a single point of contact that then we can do that at the local level. For our members, we provide leadership training, education, information to help provide the context for what they're doing. In a sense, I think of us as the radar for our members what's coming down the pike, what's happening, and how it's going to affect those programs. And finally, we also do a fair amount to raise funding so that we can provide that funding through grants to our programs so that they can feed more seniors, improve their infrastructure, and create a sustainable future.
Thanks. Before we start on the next section, which is looking at the specific factual information about senior hunger, I want to remind our audience that you can start at any time to add questions to our presenters, which we'll turn to at the end of the presentation. So you just go to the box that's on your screen, and you see there's a question drop box, and you just enter your questions there. We'll be doing that at the end of the presentation. So Ellie, let's continue with you. Let's talk about some of the myths and facts about senior hunger in America. What are some of the characteristics of older people who are hungry?
Well, before I answer the question, I want to mention that Thom and I put this deck together. We thought it would be sort of fun for the next 6 slides to provide some multiple choice questions that our participants could do while they're at their desk or in their car, as long as they're wearing a headset, of course, to think about using this as a way to impart information and to dispel some myths. So in that spirit, let's take a look at the options. So people who are hungry may A, be obese, B, have an income above poverty level, C, physically appear 14 years older than they are. I think the answer may come as a surprise because we all have our own set of stereotypical views of hunger. The correct answer in this case is actually D, all of the above. So let me explain why. A person who is actually obese may in fact suffer from what we call a hunger-obesity paradox. And that means that while a person may appear to be overnourished, they may actually be malnourished because they're eating high-calorie foods. Maybe they live close to a fast food restaurant, or they are close to a convenience store and cannot afford to either travel to or eat more healthy food, and that doesn't meet their nutritional needs. There also sometimes are situations where people may suffer from a loss of muscle mass, a loss of protein, and that's something called sarcopenia. And I say all this as a layperson myself. I'm not an MD, and I'm not speaking to people that I know have a great understanding of this, but I think it's just important to dispel the myth that we may look at somebody and we make some assumptions about their level of hunger. Another is that there's a misnomer that people who are hungry are all low income. And it's interesting because someone who is affluent that we would think would have access to food, certainly should be able to afford it, may suffer from hunger. They may be living alone. They may have lost a spouse or a partner, a loved one. They may be depressed, lonely, have no access to a store, not be able to get out of their own home. They may be recovering from an illness or injury. It could be your neighbor, and you're wondering why you haven't seen them recently. It doesn't mean because someone is hungry that they can't afford a meal. It can be that they're simply isolated and unable to get one. And finally, hunger does devastating things to our body. People who are hungry, who struggle with hunger, oftentimes have difficulty doing just basic tasks that you and I take for granted: bathing, grooming, getting dressed. And as such, hunger really, from a physical standpoint, makes someone appear as if they're 14 years older. Their physical limitations are that if someone's 14 years older than what their actual age is. So I think the bottom line here is that we all imagine what hunger looks like, but oftentimes it's a silent epidemic, and oftentimes people who are hungry are hidden, and we wouldn't think that they are.
Those are very important facts, and as you say, it sometimes does not meet our stereotype. As we go to the next slide, we have another set of options here, and this has to do with where hungry seniors live.
So as it turns out here, you can read A, B, and C. Hunger is actually location agnostic. People who are hungry live in all settings, whether on farms, in rural areas, in high-rises, in urban areas, and in neighborhoods and suburbia. So it spans everywhere. But in fact, there is a higher incidence of seniors struggling with hunger in urban areas because this is where the majority of seniors live. We call this a food desert, lack of proximity to a grocery store or supermarket. And many of our Meals on Wheels programs that serve rural communities, which is a pretty large share, so I'd say about 47% of our programs do serve rural areas. They may, a volunteer or a staff member may drive 100 miles just to be round trip to be able to deliver one meal to a senior in need. So you can imagine, multiply that times how many, rural seniors that we have that may be in need. That puts an exorbitant wear and tear on the car, cost of fuel, and most of the volunteers that do this out of their own pocket. They don't get reimbursed by programs for doing that kind of driving. So that's important. You'll hear a little bit more from Thom later about the importance of volunteerism. So that's why we talk about Meals on Wheels programs. I'm using that broad statement to describe programs that are in the community, whether they serve meals directly in homes or whether they serve the meals in a congregate or a group setting like a senior center or a church. Most of our programs provide meals in both settings. So that's why congregate settings are really important, particularly in rural areas, because they create an opportunity for many seniors to come to one place at the same time to get that socialization, and then you can provide meals in one location, which creates, a much greater efficiency than otherwise is the case.
As we go to the next slide, you've already talked about the impact that you appear 14 years older and have those health consequences, but what are some of the other consequences of hunger?
Well, not surprisingly, I would imagine we all would guess that just hunger in general worsens all age-related conditions, such as impairing oral health, hearing, vision, and mental functions. But hunger directly contributes to far more serious chronic health conditions that we're familiar with, like diabetes, hypertension, heart disease, and even dehydration. And these are often the drivers that will land a senior in the hospital or a long-term care facility. So the consequences of a poor diet also show that there, as I mentioned earlier, slower recovery time from an illness or injury. It results in a longer hospital stay, or if a person has been discharged from an illness or an injury or surgery and they're malnourished, they will end up being readmitted to the hospital far more frequently. And that then, in turn, all of those increase healthcare costs significantly. An interesting fact that I just learned the other day was that 75% of all readmissions, Medicare readmissions, were potentially preventable, and many of those can be prevented with a nutritious meal, a social visit, and a safety check from a Meals on Wheels volunteer.
Very important to know. As we go to the next slide, Ellie, continue to tell us a little bit more about the meals that are provided through senior nutrition programs.
Well, I like to say that I can personally attest to the fact that the meals are surprisingly tasty, as I've sampled them from probably 8 different programs in 8 different states over the past 8 months. And I am a very picky eater, so a lot of times we think, is this going to be really nutritional and tasty? And the answer is yes. Each meal has to meet very stringent guidelines and restrictions from the federal government, and they must meet at least 33 1/3% of the minimum dietary reference requirement. But it turns out that Meals on Wheels meals generally pack a great punch, because we know that often that meal may be the only meal a senior gets in a day. So the meal itself actually provides more than 50% or more of the daily nutritional intake requirements. And programs are very creative, so that they also try to offer variety and choice wherever they can. There may be cultural, religious, ethnic preferences of the population served. Programs are getting very adept at being able to adjust to that. If someone is unable to swallow, for example, meals can be prepared in a puree fashion, a liquid fashion if necessary. And lastly, those meals are so really healthy that they can be fed to someone who is a diabetic or has renal failure. So meals can be adapted and are very different depending on the region that you find yourself in. I think the most important thing about the meals is that the recipients themselves indicate that the meals enable them to stay in their own home and that they can avoid having to go into a hospital or a nursing home, because the meal and the social visit and the safety check, we always say that Meals on Wheels is more than just a meal. It's really that package of assurance in addition to the nutrition. 93% say I can stay in my own home much longer because I have that ability to get a meal at home.
Before we turn back to Thom, I want to remind everyone that, once again, you can add your written questions by going to the box on the side of your screen and going to the drop box that's marked questions. We'll be doing that shortly after our presentation comes to an end. So, Thom, let's come back to you as we move to the next slide. Tell us why Caesars is involved in this effort.
Okay, so on the deck, you have to entice seniors to visit Caesars properties and to gamble, B, to drive employee engagement, C, to build stronger communities, and D, to improve the quality of life for all individuals. And in this case, it is actually E, all but A. And, part of the philosophy behind the Caesars Foundation is that we're strategic in our giving. There's so many worthy causes out there that we felt to be more strategic, we could be more impactful. We also like to partner with organizations over a longer period of time. Not just a one time. And we like to involve our employees, because when we involve our employees, they're more engaged, they're more committed, and they understand why we continue to stay with an organization for a long period of time. In Nevada, where the headquarters of Caesars Entertainment, actually Las Vegas, is positioned, happens to be among the top 10 hunger states, along with Minnesota, New Mexico, Arkansas, Texas, Tennessee, Alabama, Georgia, South Carolina, and Florida. And obviously every community where Caesars Entertainment operates has older individuals that are in need of nutritious meals to help them maintain health and also to avoid the social isolation. We also know that many of the employees of Caesars Entertainment are caregivers of older individuals themselves. And part of our philosophy behind our emphasis on older individuals is to ensure that the support we provide to partner organizations is relevant to the very people who keep the organization in business, and that's the customers as well as the employees. As I mentioned, the focus on the issues of our employees care about really drive our employee engagement. And this is something the company prides itself on. Just in 2012 alone, they committed, volunteered close to 140,000 hours to community organizations. Many of them, because it is our strategic focus, are those that are focused on older individuals, such as Meals on Wheels. And finally, our decades-long partnership with Meals on Wheels, and by the way, our partnership with Meals on Wheels is our longest partnership. When we were established in 2002, one of the first organizations we partnered with was with Meals on Wheels. We've been a long-term partner with them. We just actually donated our 50th van to across the United States to help them with their drive to combat senior hunger and social isolation. But it's also, it's just focus on commitment in this partnership and our commitment to improving the quality of life of older individuals.
Well, thanks. As we go to the next slide, Ellie, we'll come back to you, and this may seem obvious, but what does Meals on Wheels care about in this regard?
Well, first and foremost, we believe that no senior should go hungry, and Meals on Wheels enables the senior to be independent and more healthy in their own home for as long as they can, as opposed to being prematurely, hospitalized or be put in a nursing home. And that's really the bottom line. This is about improving the health and quality of life, reducing isolation, improving socialization of seniors in this country. And in the richest country in the world, it's pretty much inexplicable that we have the problems that we have today.
And we'll stay with you for the next slide. Tell us a little bit more about, Yeah, Ellie, we're staying with you. And why does this all matter to the country and to the individuals involved?
Well, I think there are some pretty pivotal reasons. One, you started when you introduced the session today, John, which is the need is dire and the demand is increasing. We just got research results from the National Foundation to End Senior Hunger that increased the number. They just did a survey that showed that the number has gone from 8.3 million to 8.8 million in just 2 years. That's a significant increase. That's 1 in 6 seniors struggle with hunger today. Through Meals on Wheels, we're able to meet about 2.5 million of those seniors, but there's still a huge gap. The infrastructure exists to be able to do that, the network of senior nutrition programs with the mission to provide meals to seniors, a safety check, a social visit, but we just don't have the financial resources. The demand is increasing exponentially. Every day, a baby boomer, obviously every day a baby boomer turns 60, but at a rate of 12,000 a day, and people are turning 65 at a rate of 10,000 a day. So the number, and you just heard from Thom about the 10 states, Mississippi being the first, 10 states that have the highest hunger rates in America. 44 states have increased in senior hunger rates just in the past few years. And by 2025, 75% more will experience food insecurity than just today. So the need is dire, the demand is increasing, but I think a little-known fact that I'm trying to do a better job of advocating about is the fact that the business case exists. We can feed a senior for an entire year on Meals on Wheels for the equivalent of 1 Medicare day in the hospital. The Center for Effective Government recently published a survey or a study that they had conducted that indicated that for every $1 invested in Meals on Wheels can save up to $50 in Medicaid savings alone. That's not even including Medicare. So the business case exists, and the reason is the longer that we can keep a senior in their own home, that is, savings that go from Medicare and Medicaid that would incur from hospitalization or nursing homes, and taxpayers are the ones that ultimately bear that financial burden. The last several years, funding at the federal and state levels has been going down. That's even pre-sequester. In addition to that, food and transportation costs have been going up exponentially. Private donations have never rebounded from pre-recession levels. So even though each program on average raises 70% of their total budget from sources other than federal, state, or state funds, sequester added insult to injury. In 2013, between just June of this year and by Monday, that compressed 4-month period, senior nutrition programs were told that $51 million were going to be cut in that time period from being able to provide meals and other services for seniors in need. So that $51 million cut is on top of year-over-year declines in funding. The final thing is, so what's been the impact? We hear a lot about, well, I don't see the people who are being hurt. I don't get phone calls when we talk to officials on the Hill. Unfortunately, the people that we serve, homebound and hungry, who need assistance even getting out of their homes, they can't march on Capitol Hill. But the pain is real, and our programs in the field are telling us that as a result of sequester, they've had to add wait lists for the first time. 70% have added to wait lists or expanding existing wait lists with no promise of ever being able to rotate somebody off. Can you imagine having to tell someone who's extremely ill and perhaps, 1 meal away from landing in the hospital that I don't know when I can get you a meal. It costs on average $6 for a meal in this country through Meals on Wheels. 1 in 6 programs are having to shut down either a site, one of these congregate sites I was mentioning before, or closing their doors altogether. 1 in 4, 40% are reducing the number of staff, or just eliminating staff positions. So the pain is real. The business case exists that we should be investing in Meals on Wheels programs to help seniors stay at home. And where's this country going to be in a few years at the rate of poverty 1 in 6 when we have such an aging population? It doesn't portend a most encouraging future.
Thanks. Thom, we're going to come back to you on the next slide because you are an interesting model of organizations that most people, I think, would not immediately put together but have obviously worked together effectively over a long period. So how do you know if there is likely to be a synergy between two very different organizations like yours?
Well, I think one is that, as I mentioned a little earlier, it has to be a long-term commitment. I think, just a one-off giving to an organization doesn't allow for the time that the organizations can really bond and really kind of share a focus. And I think that's what's been unique with our relationship with Meals on Wheels. As I said, it's a decade-long relationship that has evolved over time. So there's developed some really important synergy. Obviously, Meals on Wheels is all about senior hunger, but as a corporation, as a nonprofit, we have made this our primary focus, and our brand name has been associated with that. For example, we're also a partner with Nevada Public Radio, where they brand a lot about Caesars and the Caesars Foundation. So there's constant messaging about senior hunger, about older individuals that is associated with the brand of the Caesars Foundation. We are two organizations that are nationally and geographically represented. So we have our brand, we have employees, we have our organizations in multiple places across the United States. As I mentioned before, part of our gifting of the vans, we're in communities where we operate, but we've extended a lot of our gifting to target, that we'll talk about in a few minutes, about some of the research that was done where the largest pockets of senior hunger exist, which is in some of the rural areas in the South. And then I think so that creates that strong national presence. And I think the other large thing is the volunteerism that Ellie can speak of, which is the cornerstone and bedrock of the ability of Meals on Wheels to get their meals to many socially isolated individuals. But it's something as a company we pride ourselves on. I mean, in order for us to enter into a population with a nonprofit, as an organization, we're required them to offer opportunities for our employees to be engaged in. So we have an army of volunteers. We're almost 100,000 employees nationally. So when we can turn our volunteers and have them committed to causes that the foundation supports, that can translate into many, many individuals throughout the United States engaged in this important mission.
Well, and let's continue on that theme on the next slide. We all know that partnerships are hard to develop and even harder to maintain. So you've already started talking about this somewhat, but what do you see making a great partnership?
Well, I'll jump in, and then Ellie would probably want to add to this. But one is our frequent communication. As I mentioned, the long-term partnership is important. That we're committed over time. That we really have talked about what are some of the common goals and objectives and expectations on both sides. I mean, what do we expect of an organization we give large amounts of money to? Vice versa. That's not just giving money, but how can we leverage with other corporations the call to action to actually support this cause. The other one is that there has to be frequent communication. We have to constantly in contact, in person, by phone, by email, that we really have a clear sense of if any issues are of concern. And then I think it's really important to any foundation on our part is that that there's demonstrated results or impact. And there's accountability, and that helps our giving. It helps justify our giving, not only to our employees but to our board.
Okay. Ellie, you want to add to that?
Sure. I think Thom covered it well, and I would add that it's important to understand on both sides of a partnership what the ultimate expectations and what the roles are, plus defining what success looks like at the end of the day, because. If I look at Caesars Foundation as the grantor and, say, Meals on Wheels Association as the grantee, I want to be successful for Thom. My goal is for him to feel as though he made a great investment, and I need to understand how what I do fits into the goals of Caesars Foundation, so that when I give him back reporting or give him back information, I'm also giving it to him in a form that he can then use with his board, for example. And I think the other thing is that it's really important to build trust between the two parties, and there are going to be bumps in the road. There are going to be things that are not going to work out as planned, or you learn something during the course of a grant where you may need to shift focus. And I think Thom would much rather me pick up the phone and say, hey, we learned something, this isn't working, or there's an opportunity, we'd like to deviate slightly from our understanding, would you be comfortable with that? I think having that level of communication builds trust, and then trust, as Thom said, it's really important for Caesars Foundation to have a long-term partnership. If you don't have trust, you're never going to want to make a commitment to an organization to have that kind of long-term relationship.
Thom, as we move to the next slide, we'll come back to you. Tell us what this partnership has produced so far.
Well, I think that this, long-term partnership I mentioned earlier is that, we just recently celebrated our gifting of our 50th vehicle across 18 different states in the country to provide these meals and to reach many of the socially isolated individuals. The van donation is something that, is very concrete. We can track the number of miles and the number of meals served, but it's so essential to Meals on Wheels and something that, is very concrete and can allow us to present the results that are very important to our board and to the employees. As I mentioned, as our relationship developed, one of the areas in our conversation with Meals on Wheels were some of the gaps in the research nationally on senior hunger. And so we began a conversation with Meals on Wheels about underwriting some of these gaps in research. And it's something that, was deviated from, our giving in the past. And so we had to, make a convincing argument to our board of trustees of why now are we giving to research. But, our giving should be evidence-based. It should be based upon the latest research. And in this case, there was consensus even with the many of the federal agencies that deal with senior hunger that this was missing. And so we actually underwrote through Meals on Wheels some really groundbreaking research about senior hunger that continually is being built upon today and utilized. And it also allowed us to partner with Meals on Wheels to go to Capitol Hill to actually present both at the Senate and the House of Representatives on their committees on senior hunger to demonstrate that, that the private sector can step up to the plate and provide some important gaps in the areas of senior hunger. We also funded the Mayors on Meals campaign, which encouraged local programs to get involved with their elected officials and at the community level. Since we have so many properties throughout the United States, we have good relationships with many of the elected officials, particularly on the local level, and the campaign to get them involved to provide visibility around this important topic was extraordinarily important. And then, just in dollars amount since our partnership, we've contributed over $5 million as a foundation to its member organizations over the past decade.
Those are all very important results, and all of us in the aging community, thank you for your commitment. As we move to our final slide, and which is the contact slide for our presenters, I do want to remind everyone that you can ask your questions now coming up in the next section as we start to talk about some more information about this program and the way in which these kind of relationships can be developed. So once again, if you just go to the box on your screen on the right, and there's a drop box for questions. You just type those in, and I will be asking them. For those of you that have asked about how to get copies of the slides, once again, you just send an email to info@asaging, that's asaging.org. info@asaging.org. So at this point, we'll turn to our questions, and I will be reading them and directing them, but both of our presenters will have an opportunity to respond. So the first question is, many of our audience are local funders, foundations or corporate giving programs and so on, rather than national level funders like national level programs like yourselves. What kind of successful partnerships are you seeing at the local level, and what advice would you have for local funders about how to most effectively work with programs like yours? We'll start with Ellie on that one.
Because Meals on Wheels really happens at the local community level, partnerships within the community are paramount. And I think that Meals on Wheels offers a great, public-private partnership opportunity. So I would encourage grant makers to reach out to your local Meals on Wheels program. There are many ways that that you can get involved, and many ways that you can make a difference. Several examples that recently came to mind, because we had our members together in Boston recently and sort of showcased some great opportunities. We're getting Meals on Wheels introduced to the local hospital, managed care organizations, and getting some seed money, for example, from a grantor, so that when people are discharged, we call this sort of transition of care into the local community, there usually is no discharge plan that includes nutrition, bizarrely. I think people just assume that, if you're going back to your home, you have food in the refrigerator, but guess what? If you've been in the hospital for a week, you don't want to be eating food in the refrigerator, and anyone who's come out of the hospital knows you're probably not really set up to be able to prepare meals. To help through that transition period by maybe providing free meals for 10 days while somebody's, being discharged and getting back on their feet. Also, for programs that really want to make a difference if you're a corporation, and Thom talked a little bit about volunteerism, this is a great way of getting employees engaged in programs. We're working with AZI, which is basically they're a pharmaceutical company that provides a breast cancer drug, and they're working with local Meals on Wheels programs to provide not only the funding for meals for patients with breast cancer that are being discharged from treatment back home, but they're also providing meals for the family caregiver. The local AZI employees are volunteering to go with the Meals on Wheels staff to deliver those meals. They're doing it out of the goodness of their heart. Many of these patients aren't on any of the drugs that AZI is providing, but it's just a way to get to give back to the local community. These employees love it, and obviously the recipients and their caregivers are so appreciative because it helps in their recovery.
Thom, do you have anything to add to that question?
Yeah, I think the local touch. The involving the employees in the giving and making that connection is so essential. Let me give you a very specific example. Is that during the recession that all of us weathered in the last several years, the company made a series of difficult decisions to lay off employees and to not give raises and some of those other areas. And as a nonprofit, we were concerned about, how our messaging and how our need to continue our level of funding to many of the organizations. When you have employees involved in projects that not only from a volunteer standpoint, but that they care deeply about because they have older individuals or that they actually have experienced and seen senior hunger, it makes it easier for them to understand that, even during tough economic times, we don't want to abandon our partners. So those long-term relationships, those getting employees involved in it becomes really essential.
Right. I want to turn to a question that I don't think is controversial, but it has some aspect, which is that the person is asking about the fact that from time to time, working with corporations as a nonprofit may bring people who question why the corporation may be involved, may question the relationship. For example, and the example they use are some of the relationships with Walmart, for example, which has a mixed reputation in some communities, or with some of the pharmaceutical companies. So how do you go about creating a partnership that will not only last, but also is effective in being able to be explained effectively to your constituents on the nonprofit side and your supporters on the corporate side? I'll start with Ellie on that one as well.
Thanks a lot, John. I guess I always go to starting with the end in mind, which is to say, what is it that we're trying to accomplish? And I think if you stay true to the goals that you're trying to accomplish, that becomes the emphasis rather than focusing on, is it a politically correct relationship to have or not. I think that corporations, particularly corporations that might benefit from raising their reputation and getting some positive press, should look at opportunities like Meals on Wheels as a way to improve their brand because it provides great brand lift. We rely on 2.5 million volunteers. We're the largest volunteer army, as far as I know, in the nation through Meals on Wheels. And just even going first to volunteer yourself, if you work for a corporation or if you're a grantor or a private institution, to have that experience is so emotional that it's a no-brainer, and then it's very easy to sell within your own company because it transforms you. I mean, you can sit and talk about what it feels like and what it means to deliver a meal to someone who may not see a person in a single day except for that Meals on Wheels volunteer, and it makes a big difference. So I think for partnerships that, I would not steer away. I would use this as an opportunity to show and demonstrate the power of a partnership versus, trying to worry about the press, the positive and negative. My mom always told me, emphasize the positive, de-emphasize the negative, and that's what I would encourage.
Thom?
Yeah, I think that's a very good question. I think in the case of Caesars, I keep going back to this, but it's this decades-long commitment to a cause that, also goes beyond Meals on Wheels and deals with other organizations and community-based organizations. So it makes an argument we're just not, putting lip service, that we actually is something we care very deeply about. But, there's another aspect, too. I work for their nonprofit, but I also realize that we are funded 100% from their profits. The board I work with are made up of all operators of the company. And so, they also have concerns about where we give our money and what type of branding they get. And so I really try to work with, the trustees of the importance of being impactful and strategic, but also how do you brand information? And it's not just throwing your name up there and saying, look, what all the good stuff we're doing. Instead, we've chose a branding and a messaging that we support the message of the organization. And then we subtly put our name out there. And it's a call to action. So it's a call to action not only for the organization, but perhaps to others in the community or other corporations. So when we brand our relationship with Meals on Wheels, it's a call to end senior hunger. And it's a call to donate as individuals and as corporations to this cause. We recently had a campaign several years ago in rural Nevada that we brought a mama van out there centered around access to rural health. And the campaign was where she lives should not determine whether she lives. And that was the campaign, and it was our call to action to address access to health care in rural areas. So I think that, you have to meet the needs of both organizations. Obviously, the corporation's interested in ensuring that people know they're doing good and doing well. But this also is that how you go about messaging is very important. Instead of just throwing your name up there and saying we did X, Y, and Z, we found it much more effective, a much better response from the community, where we support the call to action of the community organization. And then, again, put our name out there, but one where we're asking others to join the cause.
Thanks. Really important insights, I think. The next question really is around the question of intergenerational programs. We hear a lot about isolated seniors living alone, and that's obviously a very important constituency for these programs. But there are also seniors who are raising grandchildren and other kinds of things. So are you seeing programs and opportunities there that bring a more intergenerational flavor to some of the work you're doing? Ellie?
The answer is absolutely. My background, I came from AARP. That's how I met John Feather, as a matter of fact. And we spent a lot of time at AARP looking at the demographics of the 50-plus population and understanding that there were a lot of grandparents raising grandchildren. And one of the facts about senior hunger is that where there is a household of an senior living with a younger adult, that there's actually a higher incidence of senior hunger there because the senior will understandably give the meal to the child in the house. Actually, as an aside for a little bit of fact there, is same thing as if there's a pet sometimes, as the senior will give the food to the pet, which is why some of our programs also try to team to get pet food so that when Meals on Wheels programs deliver, they know there's a pet, they'll also bring pet food to avoid that phenomenon. But so intergenerational is very important, and two programs just to point out real quickly that I think are great examples. We've recently been talking to a driver's education program in the Midwest who's interested in working with us to combine driver's education with volunteering, student volunteering. And we're trying to identify a pilot program where we can work with the Meals on Wheels programs that they get the benefit of driving with a driver, but also then deliver meals. So it's sort of a two-for-one benefit working with the school, which I think is really great. And then the second was I was just in Richmond yesterday with my team with Feeding America and AARP Foundation to visit a merged food bank Meals on Wheels program, the only in the country that I'm aware of, called Feed More. And we had a great tour of their facility where they've sort of, merged these locations. And they do, when they deliver for seniors and they know that there's maybe a grandparent raising a grandchild or even 3 generations in there, they can also bring, say, backpacks and other things at the same time that they're bringing a meal. So that there are ways of, kind of combining all 3 into one.
Very important and very innovative sounding program. Thom, we've got a question for you, and it's about how local Meals on Wheels providers can connect with your volunteers. Is there a system that you have in place to do that?
Well, that's an interesting question, and it's twofold. One is that, so as a foundation, we have nationally and internationally adopted the issue of older individuals. So we kind of drive that conversation with many of the properties because it is something strategically we have decided over so many worthy causes that is where we primarily want to be known for and be impactful for. So part of the drive from the foundation, that's corporation support, we have a program called Heroes, which is the company's volunteer program. They prioritize with our gifts, obviously, and the issue of Meals on Wheels is one where they ask their local employees to actually adopt. So that's one angle. But it also comes the other way. I mean, our initial interest on Meals on Wheels came actually from the employees and properties as one of the populations that they wanted the foundation to focus on. So it can happen, as a driver from the foundation and the corporation, but also, the synergy at the local level. 2 years ago, we tried something a little different too. Is that we asked, we were going to give away 6 vehicles, and we asked the properties to actually put together proposals that had the best an interesting and large amount of volunteer hours to compete among themselves and establish relationships with local Meals on Wheels. So it kind of unleashed them to begin a relationship, and those that could put together, the more innovative, more productive relationship, we awarded vans and branded them in their local communities. So that kind of helped it also. So it's actually two ways. Is that I think when the Caesars Foundation's name out there, I think we've been linked so much with Meals on Wheels. There's a synergy there. So I think many of the Meals on Wheels at the local level know of our partnership because it's been so long-standing. We've been at many of their conferences. We speak at their conferences. So I think a lot of it's driven from the Meals on Wheels organizations themselves.
And it's just a reminder that when we talk to nonprofits, we often try to remind them that, particularly with corporate funders, but also all sorts of funders, to make sure that you know who in your volunteer pool and so forth may be, the spouse of someone who is an employee, maybe some relationship with an employee, maybe a neighbor, but that many corporate giving programs have a very strong driver of employee participation. That's an important part of the work. Ellie, I've got a couple specific questions for you. You mentioned that there's a $6 per meal was the average cost. Does that include the transportation costs? And if not, what would it be with the transportation costs? Let's see. And you also mentioned a report about how investments in Meals on Wheels affects Medicaid expenses, and where could someone find that?
Okay. Let me answer them in the order in which you asked me. It's a little bit over $6, probably about $6.50 or so, and that is all inclusive. So that's the average cost of a meal, which we would say to prepare and deliver a meal. Obviously, some parts of the country it's much higher than that, depending on if it's rural or where it is. Some parts of the country it could be less, but that price is sort of the all-inclusive price. With regard to the report, if that person could email me their request, I've got to look in my footnotes of my testimony to find out which report it is, and I'd be happy to send the link to that person if they don't mind. At the end, I think there's a slide for more information, so please follow up with me and I'll get you that information.
That slide is the one that's up right now, so Ellie and Thom's emails are there. And at this point, we will have to come to the close of our question session, but I'm going to ask each of our participants today to give us a final word with our funder and larger audience. So, Thom, I'm going to start with you.
I'm sorry, say that again?
I'm sorry. So we're coming to the end of our time together, and I wanted to give each of you an opportunity to have a final word, and I was going to start with you.
Thank you. Well, first of all, thank you for this opportunity to be able to present our unique and important relationship with Meals on Wheels. I mean, as a company, I think we're very proud of our work and our continued relationship. And I think it's these type of partnerships that are long-standing over a long period of time and have the vested interest of corporate America really can lend the type of resources that are needed to combat an issue like senior hunger that can be solved in a very short period of time. It's not like this is so difficult and intractable that we cannot resolve this issue of senior hunger. So I think, the unique partnership that Meals on Wheels is engaged in with the for-profit corporations like Caesars and others is really what's needed in order to make a dent in some of the problems facing us. It is the public, the nonprofit, and the private organizations' concerted effort around the cause that is really going to make a difference.
Ellie?
A couple things. First, I want to look at this from the lens of a grant maker because this is grant makers in aging after all. And I think from your perspective, you want to make sure that you're partnering with a nonprofit or a cause about which you care and where you feel you can have impact. This is an opportunity, as Thom said, this is a solution that we have the solution. This is a problem we should be able to fix. I think at the end of the day, the benefit of improving the health and nutrition well-being of our seniors translates to healthy communities, which improves economies and creates just a stronger nation, period. And it starts at the community level. I'd like to offer up for any grant maker that's interested in talking to me that I'm available, because I think as you think through whether hunger is your sweet spot or there's something else, I've had a lot of experience with partnerships, and I do understand the importance of the items that Thom went through, which is the sort of critical success factors to a successful partnership. And we're very creative, and whether it's our program or not, in how you can engage employees or how you can have local impact or how you can work with a national organization and still ensure that at the end of the day you're making a difference in a cause or a city or a community in which you care. And I'd also, if it's okay, like to thank Thom, Reilly so much and Caesars Foundation for their continued support and their long-term commitment to us, and to John, to you, to inviting me, to Steve, of course, for helping, and to the John Hartford Foundation for making this possible.
Thanks very much. And I want to thank Ellie Hollander, the President and CEO of Meals on Wheels Association of America, and Thom Reilly, the Executive Director of Caesars Foundation, for their insights and expertise. We thank you both for everything you do to make life better for older Americans. I also want to thank the John A. Hartford Foundation for their support of this series, as well as the American Society on Aging for their technical expertise. And finally, I want to thank all of you for participating in today's webinar. Have a great day.